Okay. Sorry, I'm now trying to orient myself because I am confused on my screen, but here we go. We'll try this again. Thanks everyone for being here. I'm Lindsey Reeves, and we'll just start with a little bit of an introduction. So Stacey and I are both occupational therapists, and hopefully some of you are familiar with OT, but we thought it would be fun to start with just a little bit of an introduction to our preferred occupations and things that are meaningful and purposeful to us. So in addition to being an occupational therapist, I also really enjoy spending my time traveling and being outside in nature. And so I included a picture of myself recently in Zion National Park. And I'll let Stacey introduce herself as well.
Hi everyone, I'm Stacey Morikawa, and similar to Lindsey, I like to be outdoors. I like anything active. I like sports, reading, and then I included a picture here of my greatest love of pizza. So I really enjoy eating pizza, any type, any kind, and it's one of my passions.
Love it. So just starting with what is occupational therapy? I know it is a group meeting, but I might ask some questions, so feel free to either unmute yourself or add into the chat. But as occupational therapists, we are particularly interested and really looking at how a condition is impacting a person's ability to engage in their occupations. And by occupations, we're really looking at any meaningful activity that occupies someone's time throughout the day. So that could be anything from morning and nighttime routines to going to school or work, socializing with friends, exercising or attending a class, or doing things like career exploration. So it's really any meaningful occupation. And I think a lot of times people hear the word occupation and just think work, but we're really looking at any meaningful activity in your day-to-day life. As a healthcare profession, we are really also looking at the combination of both the art and the science of helping individuals. So while we do understand a biopsychosocial model of health, we are really focused on the idea of occupation and pulling in those meaningful activities to help people cope and live with any disease or disability. And it's really about this focus in promoting that meaningful engagement into your everyday activities. So I wanted to pause there. And again, if people want to speak up or add it into the chat, what are some of your favorite occupations? Anyone can chime in. And Stacey, I can't see the chat from my screen at the moment, so if anyone does add something in there and wants, you can shout that out, that would be awesome.
Someone in the chat said, Eduardo said he loves hiking and loved the Narrows.
Nice. That was that picture. That was a beautiful hike. Anyone else have a favorite occupation?
Sarah said that she enjoys walking and playing with and feeding her dog.
Nice. That is a good companion. Wonderful. Well, thank you guys for sharing. It's helpful in our treatment as occupational therapists to really get a sense of what people's preferred occupations are, because then we use that in our treatment as a means for getting you engaged in activity and getting back to those purposeful activities. So as OTs, like I mentioned, we help people participate in those functional activities that they both have to do, but also that they want to do. And it's really through the use of the activity itself that we are promoting rehabilitation and healing. And as OTs, we also work in a variety of different settings across the lifespan, across the continuum of care. And so you might find us working in pediatric settings, in a hospital setting, in outpatient clinics, but again, across the lifespan and at any age. And then really just highlighting the idea of occupation. So because our profession is rooted in that, really understanding that this idea of occupational engagement and doing those things that you want and love to do, it leads to the benefit of positively being distracted from your condition or pain or any debilitating situation. It increases your endorphins, and then it also helps to reduce cortisol, which is our stress hormone. And then because of all of that, the outcome is that by engaging in those occupations, people experience improved self-efficacy, a better mood, and better quality of life. So that's where our profession is really rooted. And then just specifically diving into lifestyle redesign. So that's the type of occupational therapy that I practice at USC. And this is really focusing on the process of incorporating health promoting habits and routines in everyday life. And so we might use this approach with somebody who maybe has never developed healthy habits and is looking to establish those healthy routines. Or it could be during a time where someone's going through a life transition and maybe their habits and routines have been disrupted. And this might be the case during cancer treatment while you're transitioning from inpatient to outpatient care, or during treatment to remission. So there's a lot of changes that can occur with that. And so using this lifestyle redesign approach, we help to like modify those daily habits and routines. And so whether it's a life transition or this last category of maybe a healthy habit or routine was disrupted in some way, we might also want to reevaluate how to modify those habits and routines to help you maybe cope with disease or disability. And the other thing we really focus on with this lifestyle redesign approach is understanding this dynamic systems theory, or kind of like this ripple effect where one area of life doesn't live in isolation. So this is an example of if you're experiencing something like a lot of stress, that can impact a person's sleep routine. And if we're not sleeping well, they might feel fatigued. And if they're too tired, then they might not prepare a healthy meal for themselves, and that can impact their work performance. And so what we try to do in occupational therapy is take this very directed but sustainable approach, where we might start by focusing, let's first start on working on stress management and lowering overall stress. Making that one small shift can help lead to better sleep routines, better energy levels, time and energy to engage in healthy meal preparation. And as a result of all of that, it can lead to better focus and better work quality. So because everything can be interrelated, and again, going back to that biopsychosocial approach, we really just want to focus on one thing at a time and making these small changes that can lead to these larger impacts overall. And so we'll talk about some of those things today. I'll hand it over to Stacey.
Now we're going to discuss a little bit about how occupational therapy can help you across any point of your care. We felt that this was really kind of the main message and something really important. I know that with this group and age range especially, there's a lot of different life transitions and changes happening. Relationships, old relationships, new relationships, significant others, jobs, sometimes a first job, or continuing on in your career, different roles, and even juggling of different responsibilities can be happening. So I think to have a resource like OT to help can be really beneficial. As mentioned, one of the unique things about OT is that because we focus so heavily on the individual person and consider all of the things that go into an individual's life, we can help across many different points in the care. It allows us to be very versatile. So some of those different times are diagnosis, prior to your medical treatment, on the inpatient side or in the outpatient setting, and then also even following your medical treatment and into remission. I know that things will look a little bit different for everyone, and that you'll have different areas that you may need or want to focus on. So it's really just about meeting you at any point in the continuum to help address specific issues that you might be having at any given time. So for OT pre-medical treatment, prior to medical treatment, my main focus is getting to know you, as simple as it sounds. It's hugely important, and it's really important to understand habits and roles and routines, what your goals are, what your fears are, some of the things that you feel limit you, and what is important to a person going into treatment. I think building a solid relationship up front becomes one of the most important things that we as occupational therapists will do. And it allows us to work together with you to establish goals and expectations prior to treatment that are in relation to your function or well-being. So this is especially important because some of you may have found that cancer treatment can affect certain things like mood or activity or physical functioning. So by establishing that relationship very early on and collaborating on goals and things that we can work on, identifying different needs, it helps me to then be able to help you that much quicker and more effectively if or when issues do arise. In terms of occupational therapy during an inpatient stay, so when you're in the hospital, there are many areas that OT can help you address while you're inpatient, but I'm going to focus on just a couple of them. I found that these topics come up very frequently on the inpatient side, and many patients that I've worked with have identified that these are things they found really impacted them during their inpatient stay. So these are fatigue management, engagement and coping, strengthening and exercise, activities of daily living and daily routine, and then sleep hygiene. The first one that I'm going to discuss is cancer-related fatigue. So I'm sure many of you have felt what we call cancer-related fatigue. And I think many are in the understanding that's very different than fatigue that, say, maybe your friends without cancer might experience or someone after having a surgery might experience. This definition of this type of fatigue really stood out to me. So I just wanted to share that with you all. It's described as distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion related to cancer or cancer treatment that is not proportional to recent activity or interferes with normal functioning. So this just kind of hit home with me a little bit, and I always like to keep it in mind. I think it's important that what is experienced is likely very different than what most people intuitively comes to their mind when they think of the word fatigue or when they think of the word tired. It might be a little bit different than most people's kind of natural thinking of what it is. Consistent with literature and what researchers that have looked into this have found is that patients undergoing treatment, it was found that fatigue increases with cancer treatment, which makes it that more important to then try and address it during this time. Prevalence is estimated at 25% to 99% while undergoing treatment. And I know this is a very broad range, but I find that most of my patients experience some kind of fatigue, and that generally impacts their everyday functioning and well-being. A really interesting thing is that fatigue is underreported by patients. And then also, in addition to that, it's underestimated and undertreated by clinicians. So the combination of those things can be a little bit problematic and is something that we definitely want to pay attention to. It's why we as OTs focus in so heavily on it. Also, about 25 to 30% of patients will continue to experience these types of fatigue symptoms anywhere from up to 6 years after successful completion of treatment. So it kind of goes beyond just what's happening at the present time. This can be very difficult to deal with, but I think there are many ways that we as occupational therapists can help to make it more manageable so that you can participate in the things that you want to do as much as possible. And I think it also really speaks to the importance of OT, not just in treating this, but also as an advocate in this area. Okay, so the impact of fatigue, I kind of wanted to go into why is fatigue important to address and what does it impact? So if you're experiencing fatigue, it can impact your activity. You might find that you don't have your usual amount of energy or enough energy to even complete things as simple as your daily routine or things that you're used to completing. Things that you would normally find easy and that you maybe wouldn't think twice about can become that much more taxing. This decline in activity can then contribute to weakness or deconditioning and can often impact physical functioning and the ability to independently complete tasks. It can also lead to poor sleep changes poor sleep or changes in the sleep cycle. And you might find that you're not as well rested or that you don't feel as well rested and energetic as usual. And then ultimately, of course, obviously, if anyone is experiencing these things, so distressing, persistent fatigue, not sleeping well, they're becoming weaker, possibly, this can affect our emotions and our overall well-being. So when you put all of those things together, it can really lead to a decreased immune response, which is important for us to be mindful of. Okay, so now to the really good stuff, treatable factors. The nice thing is that we can help manage this, and there's things that we can do very tangibly to help with these things and make it better. So what can we treat? Although we may not be able to completely eliminate all of the things that I just discussed, the good news is that we can help manage these factors. So those things are emotional distress, sleep disturbance, decreased activity level, and then also deconditioning. So OT can play a role in managing and helping you to learn to manage all of these things really effectively. To go a little bit more into that, OT and addressing fatigue, managing fatigue and remaining engaged work in somewhat of a cyclical manner. So the idea is that helping you to manage your fatigue, to be able to be engaged, and then also helping you remain engaged in order to manage your fatigue. So it kind of works hand in hand. It's like a symbiotic relationship. While you're receiving treatment and possible side effects like fatigue, OT can help you learn how to modify and adapt a task and also adapt the environment to manage your fatigue and be able to participate in something. An example, I remember I had a patient who was an avid gamer. So she had brought all of her gaming equipment into the hospital, but she was really, really frustrated just by the fact that she would get so tired and she felt like she couldn't do this in the capacity that she wanted to. So that can be very frustrating. We were able to then find a way to adapt some of her gaming equipment, adapt her positioning and work on her positioning with her. And then she was able to play and do these different games by monitoring her symptoms, making sure that her environment was set up in a way that was kind of conducive to her being able to participate. And she was able to do this without compromising the things that she found important when she was gaming or playing these games. I'm not a gamer, so I don't know the terminology, but I think you get the idea. So there's also, in addition to that, adaptive equipment and other strategies that we can use and introduce to you to make things like simple everyday tasks more manageable, while also maximizing your ability to do those things on your own. Okay, so another important thing on the inpatient side is engagement and coping. So I wanted to go over first what some of those barriers might be, and there are quite a few while in the hospital. It's really important that I think we know and understand that psychosocial well-being is just as important as physical health, and that they're very much interconnected. So in regards to engagement and coping, I just wanted to highlight a few of the following areas that might impact someone's ability to participate in activities and then also to cope effectively when in the hospital. As I'm sure some of you have experienced, the hospital environment, it's not the most fun. You have beeping machines, people are taking your labs, many people are going in and out of your room, you're going for procedures and tests sometimes. There's a lot of distractions and interruptions, and I think this happens quite a bit. Also, the hospital, even though it can become more familiar with time, I think there may always be the sense that it will feel unfamiliar just because it's not as comfortable as home, or it's not as comfortable as somewhere where you have, your possessions around you and your loved ones around you constantly. And then lastly, depending on treatment and side effects that sometimes occur, many find themselves being in the hospital for a longer period of time, which I think can make it very difficult to remain engaged and to want to participate in different activities or occupations, as we call them. Being in the hospital can also result in limited access to desired items. So as you can't sometimes, it's the case where you can't bring different items that you would normally have at home. It's due to a couple different things. Sometimes they're too large. Sometimes it's just not reasonable. And then also right now, something that we can probably relate to is during the pandemic, I've heard a lot of people say that, they're not allowing them to bring certain items into the hospital. So I've heard patients tell me, I just want to bring my own pillow to have that for comfort. They weren't able to bring their guitar and something that they're used to playing every day. So I think this is an additional barrier that can be very challenging, is just not to be surrounded by things that make you comfortable. Next is cancer treatment. Many of the side effects that one might experience, such as nausea, vomiting, diarrhea, pain, I think these can make any of us not want to participate in activities, and make it very challenging to be motivated to do that. So it can affect overall mood and well-being. And I think that's another barrier. Another important factor is fluctuating medical status. So a lot of times you might find that events may not happen in a linear way while you're in the hospital. It's kind of maybe 2 steps forward, 1 step back, and kind of a back and forth sometimes. And that can be difficult. I think this in itself can often result in unanticipated barriers. So things that you're not expecting, or sometimes you might have to stay longer in the hospital than you thought due to side effects. And I think that can be very challenging, and affect people psychosocially. And then lastly is limited limited social support, can be very impactful on engagement and coping. Obviously, again, speaking to just the current situation that we're in with the pandemic, there's a very strict visitor policy. So there's limited access to items from home, and the visitors have limited hours, which I mentioned makes being in the hospital a lot more difficult right now. So OT as a facilitator for engagement, I think occupational therapists are really primed for being a facilitator of participation in doing different activities. So I wanted to talk about how OT can address some of these barriers that I mentioned, and help in coping and overall well-being in the hospital. One way is providing opportunities for engagement in fun activities or occupations that people enjoy, meanwhile also targeting other areas that someone might be having trouble with. So it works kind of twofold, and it's really great when we're able to address both of these things simultaneously. Just to give you an idea of this, myself and my colleague had a patient who loved golf, and he used to golf every day in his home life before he came into the hospital. He used to golf every single day, and it was just kind of part of his routine. And in addition to that, when he came in the hospital, because of treatment and deconditioning he had experienced, he also had trouble standing for really long periods of time, and he would lose his balance quite a bit. So mobility was a little bit more challenging for him. So I was able to bring in a golf ball and a putter and set it up in the hallway in the hospital, and he had the opportunity to practice his putting. So it's not surprising that when we did this, he was able to stand for his longest period of time. So I think doing it when you're practicing those things, when you're doing something that you love and that you care about, can often be a motivator for someone to do more, to participate, because it makes it fun and it makes it somewhat enjoyable, along with working on some things that you need to work on as well. I think it provided him an opportunity to participate in something that he was doing before he came into the hospital and that he was also having trouble with. So he got really excited, and he was just going around the hospital telling everyone, like, I got to golf in the hospital today. And you can tell that he was just very eager for the next session and the next opportunity to do so and to work on both things at the same time. In addition to that, OT can also help in connecting to other resources or areas on topics that might be affecting someone's engagement or their coping. To give you another example, I had a patient that, because of treatment, had lost their hair, and it was a really difficult thing for her because she always used to tell me that her long brown hair it helped define who she was, and she was very proud of it. And so for one of her treatments while she was in the hospital, we got an order from the physician or from the doctor to allow them to take her downstairs. So we took her downstairs to the Image Enhancement Center at Norris, where she was able to try on different wigs. And she was really excited to try on different styles and different colors. And she actually picked one and she ordered it. And then once she received her wig, she wore it around in the hospital every day. And just watching her energy take kind of a complete 180. She was so much more confident. You could tell it was just kind of the boost that she needed. And she was really proud to wear it. So it was exciting to see that. And I think because of that, she became more motivated to get up in the mornings. She became more motivated to participate in some of the things that she was used to doing. And it was really neat to see. So Of course, sometimes it's, obviously difficult to participate in prior leisure interests or occupations and activities in the way that you would want to. But I think OT is very unique and skilled in helping you find ways to modify activities, to be able to participate in them without having to completely give up something that you care about. So this slide is just pictures of the two people that I spoke of. The one on the left is the individual that we did some putting and golfing with. And then the one on the right is the one that got her wig. Another area that's very important is strengthening and exercise. So cancer treatment can cause debilitation, deconditioning, and reduced physical functioning. But we can use strengthening and exercise as a means to combat the negative effects of cancer treatment, including fatigue and muscle weakness and functional ability, and then try to help improve quality of life a little bit. When we work with individuals, we have an understanding of kind of the whole picture. That's something that occupational therapists, we really take into consideration the whole picture of what goes into an individual. So I think by doing so, we can have an understanding of where you're at medically, what your issues are, what specific needs you might have, and then be able to safely set you up with exercises that are appropriate or strengthening activities that are appropriate for you. Some hospital barriers to exercise, as with a lot of things while in the hospital, there can be quite a few. So some that we found patients have told us are low blood counts and the risk of exercising when those numbers are too low. Our body doesn't recuperate as quickly from activity. In addition, treatment side effects that affect someone's ability to want and be able to participate in exercise. So for example, if you're not feeling well, exercise probably doesn't sound very appealing. So things like that. Limited resources on exercises or different ways to be able to exercise in the hospital. And then also even limited knowledge or the fear of the unknown and the thought of, am I even allowed to do anything, or what things are safe to do right now? Those can all be some of the barriers in the inpatient side. Okay, again, for the good stuff, ways to engage in exercise. So in addressing these barriers, OTs can really help adapt an exercise program to kind of meet you where you are during your medical treatment, with consideration to what you're going through. And also, again, with consideration to what individualized barriers you're experiencing while in the hospital. When exercising and doing strengthening, it's about learning to adapt and modify exercises to your current state. So given what your side effects are, your fatigue level, your emotional state, these things will all be taken into consideration, and something that OT can help with in helping you learn how to do these things effectively in the hospital or in the inpatient side of care. Okay, next is activities of daily living and establishing routines. So I'm sure many of you have experienced it's very hard to have structure if you're in the hospital. I think at times, sometimes the days might all blend together. It's hard to kind of keep track, and it just kind of all is a blur. I think in addition to that, there's a lot of different procedures and tests happening, and you're interacting with a lot of different providers, which makes it hard to have a routine or a structure while you're in the hospital. I think a lot of things are unexpected, and people just come at different times, so it can be very challenging. I think one of the things is, why does this matter? Why does it matter to have a routine? Oh, I'm sorry, Lindsey, can you go to the next slide?
Yes.
Thank you. Okay, so why is this important? Establishing a routine or even making sure that you complete things that you're used to completing can really help you gain a sense of control. And I think it's one of the ways that you can have a little bit of control, because I think a lot of things can feel like they're out of your control. For example, different people coming in your rooms, different people asking you to do certain things at certain times, that takes away a little bit of control. So this establishing a routine and being in control of that can provide a little bit of, kind of a coping mechanism while you're in the hospital. It's something that you can really do for yourself, which is nice. It helps maintain a sense of independence so that you don't get weaker. And then also a daily routine and maintaining everyday tasks that you do while you're in the hospital, it can help adapt sleep and wake cycles so that you don't find your sleep cycle is all mixed up. So if you get in this sense of a routine, you have kind of different times that you do certain things, it can help your sleeping patterns. OTs can also help in establishing and integrating the schedule so that you don't feel, or so that you feel you're able to advocate for yourself and speak to those things. You can keep up with activities and maintain your independence and kind of help promote better sleep, which we all know is already difficult on the inpatient side. Okay, so I just wanted to touch on some facts and ideas specific to this population in relation to sleep. As development continues to occur, changes in sleep wake patterns and sleep hygiene behaviors already exist and are occurring even without cancer treatment. So cancer treatment on top of that will impact it even more. So with the added challenge of disease-related and treatment-related symptoms, this creates a lot of insults to sleep quality. The combination of all of those things can be very difficult on the body. The result of poor sleep can lead to, again, decreased activity, psychosocial well-being, decreased quality of life even. Okay. So in terms of sleep hygiene, some barriers in the hospital, I'm sure that you can think of many, but just to name a few, medication side effects, beeping machines, transfusions and interruptions, treatment effects, and then, even people like me coming into the room to encourage you to do something sometimes, that can also be an interruption. So all of these can lead to decreased sleep in the hospital. And in terms of some of the supports or the positive things, though, in the hospital, areas that OT can help in addressing sleep while in the hospital is, number one, advocacy is really, really important. I've had a lot of patients tell me I can't get sleep here. I have them ask, I ask them often, have you asked the nurses or the team if there's anything that can be done to help this? And a lot of my patients say no. So collaborating just to communicate needs, even if it's getting, so, some examples of specific advocacy type of things are, we've done things before where we've advocated for the patient to have a sign on their door to not bother them during specific hours so that they had a little bit less interruption and were able to get a little bit more quality of sleep. So finding solutions like those to help in that area, having nursing come in and help someone with a pre-bedtime routine is another one. And also even just making other members of the multidisciplinary team aware that a patient is having trouble sleeping. Maybe they're able to schedule things a little bit differently just to try and allow for someone to have a little bit better quality sleep. Also, establishing and integrating a routine can help promoting better sleep. So not only does this give a sense of control, but it also allows for a sense of normalcy while in the hospital, and many benefit from relaxing activities prior to sleep. So helping to explore what might work for you and your individual routine or patterns. And then lastly, simply helping you to understand what things are actually impacting your sleep. So something as simple as opening the blinds or limiting naps can help your body in adapting your sleep-wake cycles and kind of knowing when it's normal to be awake versus when it's time to sleep. Also, as I mentioned in prior slides, I think exercise is also a way that you can help the body to get a better quality of sleep as well. Okay, so in terms of OT following inpatient stay, I wanted to highlight some areas that OT can help following an inpatient stay. So after being in the hospital, once you're at home, out of the hospital, areas that you might find you're having trouble with following inpatient treatment, and then also even into the remission stage. Here's a list of some of the things, and we're going to go into a few of these even further. These are the ones that we'll go into. Oh no, you're okay. So we'll concentrate on a few of these other ones. The first being exercise. I find that many people would like to return to exercise, but don't necessarily know how or what the best way to do it is. So with OT, we can help you learn and understand your limitations and understand your precautions and how to exercise safely. In doing so, we also collaborate in exploring exercises that might be appropriate for you at any given time. And we can help build exercise also into your home routine. In the outpatient setting, some of the goals for exercise include improving quality of life and self-esteem, improving function of body systems, combating long-term side effects of treatment, using exercise as a coping strategy, improving physical function, strength and aerobic capacity, fall prevention, improving sleep, and then also contributing to cognitive functioning. And some forms of exercise that we might incorporate into an exercise program are resistance training, endurance building, aerobic exercise, sometimes with modifications, balance training, stretching exercises, breathing exercises, and then also exercising during participation in occupation. So I think that's something that really brought me to OT, and why I love it is because we can incorporate function and occupation even into exercise. So it's not just about doing 10 reps of this and 10 reps of that. It's about how can we incorporate function and the things that you care about, make it fun and manageable in order to work towards your goals when exercising.
So I'm going to jump in now more on the outpatient side. And I did see a question come in during Stacey's chat. And so if we don't address them now, we will be sure to address them at the end if there's time for questions. So another component of that outpatient treatment is following cancer treatment. Pain is a very common complaint that people experience and report. And so pain management is a really big component of this outpatient kind of ongoing treatment. And similar to that sort of dynamic system that I showed you earlier on, pain can have this effect in a lot of different areas of a person's life. So pain can be linked to feeling more stressed. It can impact your sleep routine. It can make you be less active because of that fear of pain onset. And so in the outpatient setting, we treat the pain directly, but we also work on managing all of these other factors as well to help cope and manage the pain better. And the way that we address that are through a variety of different pain coping strategies, looking both at the psychological factors that influence pain and the behavioral factors. So pain is very influenced by our psychological state. And so we want to work on things like changing our thoughts and reactions to pain, learning coping techniques and relaxation techniques to help turn off that pain signaling system in our body, building social supports and staying hopeful. Those are all like proven evidence-based ways of managing the stress of pain. And then also looking at the behavioral factors that influence pain. So building awareness about triggers and alleviating factors, probably carrying over some of those energy conservation and pacing strategies that you might have learned in the hospital into the outpatient life. Looking at positioning, Stacey talked a lot about exercise. Our sleep routines are going to be important for pain management. So it's nice to kind of be aware that all of these things can help manage pain, because a lot of times with pain, it can feel like there's nothing I can do that's in my control. But this is a good reminder that there's a lot of things that do actually influence that pain signaling system. Carrying on with what Stacey started to introduce with sleep hygiene. So really sleep hygiene is just the habits and routines around sleep that are either positively influencing sleep or maybe having a negative impact and leading to sleep impairments and sleep disruptions. And if we think about pain and cancer-related fatigue and stress, sleep can help manage all of those things. So our sleep routines are a really important thing that, again, in the outpatient setting, when I'm working with patients, a lot of patients will report challenges with their sleep routines, and it's an area that I really want to help regulate. So sleep hygiene strategies are things like sticking to a very consistent sleep and wake schedule. Our body really likes routine, so we want to create a similar routine just through our sleep cycle. If you're having a hard time falling asleep or staying asleep through the night, it's recommended to kind of get up, maybe go into another room, do a relaxing activity, and then try again and come back to sleep, because we really don't want to associate our bedroom with this awake, frustrated state. Things like looking at our diet and avoiding caffeine and stimulants before sleep, maybe setting a limit on time of day that you have your last cup of tea or coffee. Really only using the bed for sleep and creating bedtime routines and rituals. And really looking at what is it that I'm doing before bed? Are those activities more stimulating and maybe keeping me awake and alert? Or are they really relaxing and promoting this idea of sleep onset? So that's what we want to work towards. And then also taking a look at people's environment. There can be a lot of physical barriers similar to the hospital, but now in your own home context, whether it's light or sound or other people. So those are some factors to consider. Diving a little more specifically into some of those recommendations, we do want to sleep between the same hours every day. Our body functions on this 24-hour rhythm. And so we want our sleep routine to align with that. So whatever, and everyone kind of has a different preference. So figuring out what hours are best for you, how many hours of sleep are best for you, and then trying to stick to that consistent schedule each night with as limited variability as possible. With getting up and trying again, so it's usually recommended if you're not able to fall asleep within that 20-minute time frame, then it's a good idea to change your environment, go do something relaxing, whether it's listening to calm music or maybe doing a meditation, reading, nothing that's going to make you more awake, but just something to kind of give our mind a break from that frustrated feeling of not being able to fall asleep. And after you do that for a little while, then it's appropriate to go back into your bedroom to try to fall asleep again. And then, as I mentioned, we really want our bed to be a place for sleep and sleep only. Our body and our brain really learn to associate environments with certain activities. And so if we're doing schoolwork and gaming and FaceTiming with friends, and we're doing all of that in our bedroom, then our brain's not going to associate our bedroom with sleep. It's going to associate it with all those activities. And so it's going to be harder to fall asleep. So we really want to monitor the environment in that sense as well. And then this is just an example of how to create something like a bedtime routine, really progressing during the evening hours from activities of higher stimulation to something more moderate to something really low stimulating, so that you're gradually transitioning both your brain and your body into this idea of, okay, I'm preparing for relaxation and rest and sleep, so that when you do get into bed, you're ready for that. Your brain's ready to shut down. So this example here is moving from maybe being on the computer where you're working and you're getting blue light input, to stopping that at a certain time and transitioning into more of your self-care routines as a cue and a signal that, okay, this means I'm getting ready for bed. And then maybe finishing with a relaxation technique or reading a book before bed. And then hopefully that makes it easier to fall and stay asleep through the night. Stress management. So Stacey also talked about the psychosocial effects of living and receiving cancer treatment. And I don't think that goes away in that outpatient time. So with the ongoing stress, it's really important that we have the tools and resources to manage stress in any situation. And so the process I usually go through with people is, first we have to figure out, in order to better manage stress, we want to be aware of what triggers stress, whether it's living with cancer, difficulty with family members, a hard time communicating with my healthcare provider, COVID, there's so many potential triggers. So first exploring what causes stress for you, and then understanding how you personally experience stress, because it is such an individualized experience. Some people will notice more of those physiological effects of increased heart rate and shallow breathing. Other people might find that behaviorally they tend to isolate, or maybe they turn to emotional eating. So figuring out, again, how do you respond to stress? And then with that awareness, what can we do about it? What healthy coping strategies can we implement to better manage stress? And so in our outpatient treatment, we'll talk about a variety of different coping strategies. A lot of them are listed here. And then helping individuals figure out which of these coping strategies really resonate with them. Some people are going to lean more towards those relaxation techniques and mindfulness practices. Other people might really look for that social support. And other people might really respond well to creative activities and journaling and writing. So it's really about figuring out what works best for you. But there are so many healthy coping strategies, and it's really about replacing any negative coping mechanisms with some of these healthy stress management strategies. The relaxation techniques are a type of coping mechanism that have probably the most evidence behind them for stress management because of how they really target our nervous system and really shut off that stress response. And so again, I'll go through different practices with my patients, training them in these different strategies, and again, helping them figure out which of these really resonates best with them. And also thinking about the timing of relaxation and coping. So a lot of times we focus on, once I feel stressed, what can I do to better manage it? But we really also want to think about how can I preventatively do something so that maybe I never get to that peak stress point. So if you know you're going to be going into a stressful situation, are there things that I can be doing beforehand, maybe during that event, and even afterwards to prevent this huge spike or rush of stress onset? And so here's an example. I think, a lot of times I do this with patients in areas of like preparing for going to maybe a healthcare appointment, if that is a source of stress for them. And so thinking about, before I go to the appointment, how can I regulate my nervous system just through my healthy habits and routines? Maybe I want to talk to friends and family about why I'm feeling stressed for the appointment. Maybe I engage in a relaxation technique. And I also think specifically for that example, doing things like preparing for the healthcare appointment, maybe writing questions down or concerns down so that in the moment of the appointment, you can use that as a resource. And maybe during the stressful event itself, practicing some of those relaxation techniques. And then afterwards, also prioritizing time to unwind and allow yourself time and space to come down from that stressful event as well. Time management is another category. So I actually think time management and stress management go hand in hand. I think if we're managing our time well, we can potentially prevent and avoid a lot of stressors. And so time management is this idea of having the tools and resources to efficiently, but also effectively use your time so that you can manage your productivity, but also be satisfied with your time use, being happy with the way that you're spending your time. And so similarly to the stress management kind of progression, first we have to be aware of time and how we're using it. Then we work through identifying potential barriers and things that interfere with managing time effectively, and then using some tools and resources like prioritizing, scheduling, and organizing to help us manage our time more effectively. And I think this is really important, again, in this sort of continuum of care and the different stages of treatment, because the way that you spend your time is going to change during all of that. And so we really want to practice the idea of reevaluating during each stage. How am I spending my time? Am I doing the things that are meaningful and purposeful to me? And if not, how do I need to modify my time management and my tools that I'm using to be more satisfied with all of that? So these are some time management strategies, and we're actually going to do some breakout rooms. So we might dive into some of these a little bit more. But really quickly, like having one time management tool, not having too many priorities in a day. So not setting yourself up for more than maybe 5 priorities on any single day. Making sure that you're building in time in your day. So understanding that everything takes time. And so when we don't account for things like travel time or how long it takes to walk from my car into my healthcare appointment, or, the time it takes to log into some of these online sessions. So we have to account for all of that. And not only just scheduling like the activity itself, but everything around that. So again, we want to account for all of the components that lead into it. Sometimes planning backwards is a helpful way to manage time. And, taking a moment I like to say practice saying no, but even just saying maybe, to really take some time to evaluate whether or not it's something you want to agree to and a way that you want to spend your time doing a certain activity. We'll also talk a little bit more about lifestyle balance in the breakout room, just understanding that we used to think about balance as like a linear road. So it's either like doing work in school and being productive, and that can be depleting, or on the other end of the spectrum are non-work and restorative activities, and trying to find the balance between the two. But now we really want to think about this new model of balance, which there can be work and school related activities that can be restorative or depleting. And there can also be non-work activities that can be restorative or depleting. So really thinking about finding more of a balance between restoration and depletion rather than work and non-work. And again, we'll talk a little bit more about that. And then another area in the outpatient setting that I often work on with people is just the reintegration piece. So as you've gone through treatment, reintegrating back into society can be challenging. And these are some of the common barriers that people with cancer have expressed. So whether it's having a hard time getting back to the occupations that you previously engaged in, maybe a lack of understanding from family, friends, or just people in society. You may feel disconnected or have lost connections to people that were in your life before cancer. Also, just having gone through treatment, you might have a change in your values and your outlook on life. And so figuring out what new occupations and what new activities you want to take up your time is a transition in itself. And so as an OT, those are all the things that we want to work on with you, is figuring out how to reintegrate in a way that meets you where you are. So some of the ways that we do that with you are, gradual return to school and work plans. We work on the advocacy piece by helping people with work or school accommodations if that's needed. Thinking about gradual reentry is another, also thinking about activity pacing. So how do we get you back to those activities with the symptoms that you might be managing right now, whether that's fatigue or pain? Like Stacey said in the hospital, the idea of establishing routines is going to be really helpful for reintegration. And then problem solving any potential barriers that might come up. And then again, building a new or existing social network. So finding those community resources, support groups. What we're doing here today is a good example of that. So those are all the things that we do as OTs to help with reintegration. And those are some of the topics that we would highlight in our outpatient setting. We couldn't go through all of them today, but that hopefully gives you guys a good idea. And then what we wanted to do next is dive into breakout rooms to specifically go into some of these topics in a little more detail. So I'm gonna have Stacey jump back in and help us with that.
Thanks, Lindsey. Just one more second. I'm gonna change a couple things and just get the settings